Namaskar, my friends. Today is 6th day of Navaratri. We worship today Maa Katyayani and Shashti of Maa Durga Puja. Tomorrow is Saptami. I am going to discuss one very important topic today. Maa Durga is always there to kill the Asuras. But we, healthcare professionals, are facing a new Asura today, that is antimicrobial resistance. And today, I am going to discuss one important aspect of this antimicrobial resistance, that is One Health approach. Let's start today's journey on One Health approach to combat against antimicrobial resistance. So first of all, if we can go through this slide, we can understand what are the 10 important threats for global health as decided by WHO. And we can see antimicrobial resistance is one of the top 10 threats for global health. At present, we can see the number is around 12,70,000 deaths per year due to this antimicrobial resistance. But according to WHO, in 2050, there will be 10 crores death due to this antimicrobial resistance per year. So this is really a concerning number. We need to prepare our strategies to minimize this condition. We can see with cancer, which is also estimated the top threat for global health, the antimicrobial resistance is also there and competing with cancer. We know the situation very well of this antimicrobial resistance issues. And for you who are listening now, it is not only important for the healthcare professionals to increase the awareness about this. We need to educate common people who are there at the consumer level. Because of them also, this situation is arising. We often tell our doctor, I need quick recovery from this fever, so please prescribe me antibiotic. We often directly go to the chemist shop and ask the pharmacist to please give me antibiotic. I have this tooth pain, I have this loose motion, so please give me some antibiotic to control that. This type of behavior is going to kill us, kill almost 10 crores people in 2050. So when we talk about antimicrobial resistance, this is associated with loss in productivity. This is going to increase healthcare cost. And ultimately what happens? We will become more poor. So we need to prevent that. And it is important to consider antimicrobial resistance is not confined to a single domain. That means only with us, human. The other important stakeholders are environmental reservoirs like soil, like water sources, industrial areas, farm waste, other pollutant ecological niches, along with the hospital settings. So these are important socio-economic drivers. Maybe the first pictures that is a we are very proud of that. That World Trade Center was they had make it in Indian color. Yes, India is now the new business hub for the world. Our business is going up and up, but important message is trade is an important driver for developing antimicrobial resistance, along with some other issues like social disasters like war, which may lead to crises like migration. These all can increase the antimicrobial resistance. And when we talk about antibiotic use in human and animal population, if we use it irrationally, then what happens? Even the presence of drug residues or the resistance genes in the environment that will contribute to the local and worldwide spread of antimicrobial resistance. So here in this picture, we can see the human, the animal, the environmental reservoir like that water source, those forests, all are important stakeholders of developing antimicrobial resistance. I had a very good conversation with one of the very good, I must appreciate, wildlife doctor in this state, Dr. Shivaji Bhattacharya. He had told me about the resistance, antimicrobial resistance in Royal Bengal tigers who are present in very far from the city, in the deepest of forest, but they are developing antimicrobial resistance. Why? Maybe the cause is us. Our reach is now also there. The water is there. When we are, even few days back when I had visited Sundarban, I had seen we are taking some chips and packets are all the packets of chips are fall down into the water river. So these unfortunate events done by us actually causing the spread of this antimicrobial resistance. He had also shared some stories of mynas which were captured from the deepest of the forest, and when they were kept in some hospitals in the zoo, so it was found to be found to have E. coli, which is resistant to all common antibiotic. So how those birds develop this type of infections? So this is a real threat to us. And as we are talking about antimicrobial resistance, it is important to consider the health of humans is intricately intertwined with that of animals and the environment. And this interconnectedness is especially significant in the light of the rising prevalence of multi-drug resistant superbugs like Staph aureus, E. coli, Klebsiella pneumoniae. And this is a real situation which had been seen by multiple researchers. So this is going to impose a substantial burden on global public health. Our ancestors were very wise They told us, they taught us, Ayang Nija Paroveti, Ganona Laguchesham, Udaro Charitanandu, Basudhaiva Kutumbakam. So Basudhaiva Kutumbakam was the ethos of our society. This is mine, that is his, say the small-minded persons. The wise believe that entire world is a family. And here family does not mean only the world of human, but also world of animal kingdom, world of environment, trees, everything. So that is why they told us, they taught us the mantra of Vasudhaiva Kutumbakam. Also, in Upanishad, they had told, Loka Samasta Sukhino Bhavantu. Let the entire world be happy. Otherwise, I would not become happy. Even they told us, Jiveshu Karuna Chapi, Maitriteshu Vichikshadam. So we need to become compassionate and friendly to all living beings. So these messages from our ancestors are often forgotten by us. So this time we had witnessed the G20 meet, and we have seen our global leaders also sit together, and they were talking about one earth, one family, one future. But in this earth, we need to consider not only the human, but also the animal and overall the environment. Otherwise, our family is not complete and our future is going to face a huge challenge. So, One Health means the three important stakeholders need to become healthy. Human health, animal health, and also environmental health. And that is why the organizations like Food and Agriculture Organization, FAO, World Organization for Animal Health, WOH, or it was previously named as OIE, that is Office International des Ibijutis, and our WHO, World Health Organization. Now also, I think United Nations also came into this picture, the UNIF, UNICEF also, they entered into this picture, and there is a tetrapartite agreement between them, which was tripartite in 2019. Now in 2022, there was an update and it becomes tetrapartite. So One Health means the people who protect human, animal, and environmental health, associated partners. So that is the One Health. And for One Health, we need 3 C. What are those 3 C's? Number 1, we should have a proper coordination. Number 2, communication. And number 3, collaboration. If we have these 3 C, then we can achieve the best health outcomes for people, animals, and plants, and our environment. So this is One Health. So the One Health approach can prevent outbreaks of zoonotic disease in animals and people. This can improve the food safety and security. This we are going to discuss how this One Health approach can reduce antimicrobial resistant infections, overall improvement in human and animal health, protecting global health security, and biodiversity with environmental conservation. So when we talk about antimicrobial resistance, so this antimicrobial resistance germs can spread between people, animals, and the environment. So if we understand this complex relationship in this picture, we can understand the complex transmission paths between human, environment, agricultural, and clinical reservoirs of antimicrobial resistant genes and drug resistant pathogens. So when we talk about only hospitals or clinic, that is a very small portion of this a huge One Health map. So that is one small part only. We know the hospitals are there, the clinics are there. There could be a nosocomial dissemination of antimicrobial resistant germs. But not only that, the waste product, if we not dispose properly, it will go to the sewage, the water supply, and ultimately will consumption. Even there is a bidirectional relationship. Those who got those nosocomial infection, their waste product also went into the water. So ultimately, the environment will be contaminated. And apart from that, there is another important stakeholders, the animals. We got infection, the zoonotic infections from the animals, birds, because our environment, our water can be contaminated with those those microbial organisms. Also, as we take food, we can consume those bacteria directly from those via those food. The agricultural field, if we want to take some good salad of cucumber or tomatoes, we don't know that tomato may have some microbial organisms. Now, if we talk about antibiotic, the same thing may happen. If it is not properly disposed, so they will go into directly to the water, and from that water we may have some continuous antibiotic consumption. The antibiotic often used in the farming, antibiotic sometimes even used in animals, used by the farmers. So the vegetables will be contaminated by the antibiotics also. And sometimes these vectors play a very important role. Some flies, some birds like crows, they are become the vector to contaminate us. So this picture signifies how human, environment, agricultural system, they behave as a clinical reservoir of AMR genes and drug-resistant pathogens. And that may be an important aspect when we are talking about One Health approach. We need to target these complex transmission paths. I want to though I am not at all a veterinary medicine expert, but all the literatures are suggesting that there is a provision of using prophylactically antibiotic use are there in veterinary medicine. So when there is an introduction of new animals or some overcrowded, unsanitary conditions, transportation stress, or even the age-related vulnerabilities, there the veterinary practitioner or even sometimes lay people who are engaged in this type of work, they use antibiotics. And this become a double-edged sword there. And that is a possibility for emergence and dissemination of drug-resistant microorganisms within animal populations. And they ultimately find their way into human population, maybe through the environmental sources or via the food chain. So we need to address this double-edged sword carefully. Even in the poultry and aquaculture, it was seen. In US, they had done this study and they had shown if they use antibiotics in poultry or aquaculture, there is an economic benefit of 1% to 10%. So whether this could be a prophylactic gains versus overall efficiency gain of that particular poultry, that is a question mark, debatable issue. But nowadays, our veterinary scientists, they are advocating to have a shift toward the antibiotic-free poultry. And during the aquaculture settings, there are challenges like hygiene issues, the housing conditions, and overall health conditions. So there also, the FAO, OIE, and WHO, they are against use of antibiotic there. So antibiotic growth promotion advisory came and they were against using unnecessary antibiotics there. They advocate to limit the use of antibiotic in aquaculture. So in animal agriculture, it was seen that 2/3 of global antibiotic are used in farming, especially rising the meat consumption situation overall that drives wood demand, and that demand is associated with using antibiotics more. So this is a vicious cycle. And in US, recent studies suggest that there is a surge in antibiotic use and 80% were used in fishes and cattle. So there is concern about superbugs, antimicrobial resistance genes, and they are now advocating this One Health approach. They are telling this One Health approach is vital to prevent antimicrobial resistance. Also, the heavy metals, biocides, and they are all coming into the picture of antimicrobial resistance. As the pollution is growing up, the livestock production faces some challenges too. So they use antibiotic there, and ultimately there will be a selective pressure on those antimicrobial resistance genes. And we know this could facilitate if we use more antibiotic there. So ultimately the antimicrobial resistance genes will be developed, and this will facilitate the horizontal gene transfer. So ultimately, as in the lower middle economic countries, the economic activity is growing up, that also spurs the antibiotic use. So we need to address antimicrobial resistance in those environmental ecosystem. We need to estimate the antibiotic resistance. And for that, some newer technologies like whole genome sequencing, metagenomics, and having accurate metadata, the access to the accurate metadata is extremely crucial. Just for an example, when we talk about metagenomics, if we combine it with innovative technologies like metagenome HIC, that will provide insights into pathogen-specific antimicrobial resistance gene. Association with them, we can understand easily. So DNA extraction directly from a microbiome without isolation and purification steps. Then the high throughput DNA sequencing. Then if we have a microbiome abundance and phylogenetic analysis carried out, then need to have some specific statistical analysis to understand alpha diversity, that means variance within a microbiome, and beta diversity, that is the variance between microbiome. Also, we need to carry out the microbiome functional analysis that will give us information about the functional diversity, variance of genes, variance in proteins. And if we have this data that can help us to combat against AMR, antimicrobial resistance. So when we talk about large genomic data sets, previous studies done, and they have revealed connections between E. coli outbreaks and contaminated animal and plant food products. So this is immensely helpful for us. So why One Health is important? As our overall population grows, our connection with animals and the environment changes. We live closer together. The change in climate and land use that also facilitate these interactions, adverse interaction, more global travel, trade, and also need to consider now animals are more than just food. So these all factors, including those environmental and animal, human adverse interactions, this make it easier for diseases to spread between animals and people. So when we talk about One Health approach, this tackles shared health threats by looking at all angles: human, animal, plant, and environment. So One Health issues not only include the antimicrobial resistance. If we take care of One Health, that can also address different zoonotic diseases. Very recently, we had faced a dreadful pandemic, the COVID-19, which also raises many questions about this zoonotic nature. Apart from that, if we have a good One Health, our food will be safe. So food safety and security is another important issue. Even the vector-borne diseases. Again, I was talking with one of the veterinary doctor. He was telling me, we don't know if there are certain bacteria which can destroy the mosquito repellents, the DDTs, and that bacteria may reside inside the mosquito and helping them, preventing their death by DDT maybe. Because of that bacteria, they can change the DDT chemically and the mosquito not die by the DDTs. We don't know how they do that. But maybe very recently we are also facing epidemic of dengue here in Kolkata. We don't know whether this is one of the cause. So we need to understand this relationship. Maybe there could be some symbiotic bacteria for those mosquitoes, and they reside inside the mosquito and help the mosquito to prevent their death by those chemicals. So this aspect, our researchers need to intervene and tell us about the truth. Other environmental health concerns that also can be addressed by this One Health approach. We talk about chronic diseases like diabetes. We know how it is important to give emphasis on our gut microbiome health. So if we consume antibiotic unnecessarily, that antibiotic from the environmental sources, that antibiotic from some animal food sources, that can destroy our good gut microbiome, and that can make our gut filled with bad gut microbiome. So there is a possibility of dysbiosis in our gut that may lead to lots of chronic diseases like diabetes, like other metabolic problems, even the allergic disease. Now, we know how the allergic disease may arise after having a bad gut. Mental health, that is again a challenge. And also there is a relationship between good gut microbiome and mental health. But apart from that, the One Health, the environment, the scene, everything is important for our mental health. And obviously, the occupational health is related with this One Health. So One Health, we need to connect human, animal, and environmental health. Just want to finish today's presentation with this case we had faced maybe 3 years back. The 66-year type 2 diabetic hypertensive lady had attended OPD with left lower limb cellulitis. Now empirically linezolid was initiated, but after 4 days, there were high-grade fever, drowsiness, CBG was 178 milligram per TL. So glycemic control was almost okay. Admitted in hospital with a shock, high temperature. So meropenem given, ticoplanin started, IV insulin infusion, PPI paracetamol, that was all given. The test results suggest there is leukocytosis, neutrophilic leukocytosis. CRP was very high, creatinine 1.9. Now, blood culture sensitivity after 3 days, it was found to be multi-drug resistance Staph aureus. So tigecycline was initiated, but the patient had developed hepatic coma, maybe due to tigecycline. We know sometimes it may happen. And ultimately, she died. Just a short struggle history. When we talk with her son, he told us about their recent visit to Kedarnath 1 month back. The lady had used horse to reach temple, and her son recalls that that specific horse had a oozing boils near its back. This is very important to note. Yes, we understand the lady died due to multi-drug resistant Staphylococcus aureus. Now the question is, who is the culprit then? Yes, according to the medical report, due to multi-drug resistant Staphylococcus aureus, the unfortunate lady had developed that sepsis and she died due to tigecycline-induced hepatic coma, hepatitis and relevant coma. So there were in the discharge certificate, it may be written as septic shock, and the cause of the infection is multi-drug resistant Staphylococcus aureus. But actually, who is the culprit? The son told the horse was the culprit because the horse had a boil and maybe her mother got infection from that particular horse. But is it true? The question is how the horse got that resistant Staphylococcus aureus. Again, we need to give emphasis on that, the One Health concept. It is how a horse get an infection by Staphylococcus aureus, which is multi-drug resistant. Yes, obviously we don't get the report of that particular horse, but yes, we are assuming like that. The most important concern, the most important culprit is we are ignoring our One Health concept. And that is the reason why we are not properly fighting against antimicrobial resistance. So One Health involves everyone. And for that, the 3C we had mentioned, collaboration, communication, and coordination between all the stakeholders, the healthcare professionals, veterinary doctors, veterinary scientists, agricultural work, pet owners, policymakers, ecologists, laboratory workers, epidemiologists. They need to work together. That is the key to One Health. Thank you very much. I think from tomorrow, we will start our Durga Bandhana. Tomorrow, even today's Bodhan will be started. Today is Shashti Puja. From tomorrow, it is Saptami, Mahasaptami. So when we worship Maa Durga, if you just think about that, the Maa Durga and Maa Durga's sons and daughters, they're the symbol of humanity, humans. Then they all are dependent on their bahanas. Maa Durga has Singha, lion. Kartik has peacock. Maa Saraswati has swan. Maa Lakshmi has owl. Lord Ganesha has rat, mouse. So all are dependent on their bahanas. So they are the symbols of our animal kingdom. And finally, we all know that the puja will start with offering our worship to Naba Patrika, the banana tree. So we start worship our worshipping to pray to the environment. So Durga Puja is a perfect example by which our ancestors had started worship to our human. They worship our not only human, but also the animals. And finally, the most importantly, the puja starts with worshipping the environment. So we need to consider human, animal, and environment to become healthy, because these three are important stakeholders of one health approach. Thank you. If you have any question, if you have any comments, you can put in the chat box. Thank you. Wish you a very happy puja. Thank you. Namaskar.